Hello everyone. Today we'll be talking about the ASA Physical Status Classification System. The ASA Physical Status Classification System has been in use for over 60 years. The purpose of the system is to assess and communicate a patient's pre-anesthesia medical comorbidities. However, you need to know that the classification system alone does not predict the perioperative risks, but is used with other factors such as the type of surgery, frailty, level of deconditioning. It can be helpful in predicting perioperative risks. The definitions and examples shown in the table below are guidelines for the clinician. To improve communication and assessment at a specific institution, anesthesiology departments may choose to develop institutional specific examples to supplement the ASA approved examples. The examples in the table below address adult patients and are not necessarily applicable to pediatric or obstetric patients. Assigning a physical status classification level is a clinical decision based on multiple factors. While the physical status classification may initially be determined at various times during the preoperative assessment of the patient, the final assignment of physical status classification is made on the day of anesthesia care by the anesthesiologist after evaluating the patient. So this is the table that's showing the ASA American Society of Anesthesiologists Physical Status Classification System. So there are a total of 5 classes, or others call it 6 classes. So ASA 1. So the description is normal or healthy patients. ASA 2, mild to moderate systemic disease. ASA 3, severe systemic disease but still active. ASA 4, severe systemic disease and incapacitated. ASA 5, moribund or terminally ill. ASA E, that's emergency. So I'll explain this in more detail using this diagram. So ASA 1 usually refers to a normal healthy patient. So an example includes healthy, non-smoking, no or minimal alcohol use. ASA 2, a patient with mild systemic disease, mild disease only without substantive functional limitations. Examples include but are not limited to current smoker, social alcohol drinker, pregnancy, obesity, well-controlled diabetes or hypertension, mild lung disease. ASA 3, a patient with severe systemic disease, substantive functional limitations, one or more moderate to severe diseases. Examples include poorly controlled diabetes mellitus or hypertension, chronic obstructive pulmonary disease, morbid obesity in which the BMI is greater than or equal to 40, active hepatitis, alcohol dependence or abuse, implanted pacemaker, moderate reduction of ejection fraction, ASRD, and undergoing regularly scheduled dialysis, that's end-stage renal disease, premature infant with PCA is less than 60 weeks, history of greater than 3 months of myocardial infarction, cerebrovascular accident, transient ischemic attack, or coronary artery disease or stents. ASA 4, a patient with severe systemic disease that is a constant threat to life. Examples include recent less than 3 months of myocardial infarction, cerebrovascular accident, transient ischemic attack, or coronary artery disease or stents, ongoing cardiac ischemia or severe valve dysfunction, severe reduction of ejection fraction, sepsis, disseminated intravascular coagulation, acute renal disease or end-stage renal disease not undergoing regularly scheduled dialysis. ASA 5, a moribund patient who is not expected to survive without the operation. Examples include but not limited to ruptured abdominal or thoracic aneurysm, massive trauma, intracranial bleed with mass effect, ischemic bowel in the face of significant cardiac pathology or multiple organ system dysfunction. ASA 6, a declared brain dead patient whose organs are being removed for donor purposes. You need to know that next to the above classification, we could attach a E, which denotes emergency surgery. So you could have ASA 2 and then a E. So that means that that's emergency surgery. Emergency is defined as existing when delay in treatment of the patient would lead to a significant increase in the threat to life body part. So we just talked about the ASA classification. Now we'll just look at the mortality. So ASA class 1 mortality is less than 0.03%, ASA 2 mortality is 0.2%, ASA 3 mortality is 1.2%, ASA 4 mortality is 8%, ASA 5 mortality is 34%. Then then emergency, so whichever is going to be attached to the mortality will be increased. So that's all about ASA classification. Thank you very much. If you like the video, please like, subscribe and comment.